I'm Agathe Leon. I'm an HIV consultant of Infectious Disease Department in Hospital Clinic in Barcelona. My work involves two main areas. The first one is pharmaceutical prevention of HIV, prophylaxis post-exposure, prophylaxis pre-exposure. And the second one is the development of new models. The first model is the telemedicine. Is a web-based system that allows to the patients to be controlled through internet. And there's a multidisciplinary team involving infectologists, nurses, pharmaceutics, psychologists, which care the patients through a video conference. And the patient just go to the hospital to perform the blood test and receive, if they want, the medications through a courier. This system was, we perform a randomized clinical study comparing the face-to-face consultation, comparing the usual care with the virtual care, and we have seen that the results in terms of immunological, virological control, as well as adherence to antiretroviral therapy was the same. And after this study, this system of the control through internet was become routine in our hospital, and we are caring now 500 patients through this system. The second system is we call a shared care unit, and is a unit that we have developed with primary care centers with three main objectives. The first one is to improve knowledge, then teaching, and we perform sessions, workshops, and stages in infectious disease for ameliorate the knowledge in HIV. The second part is care, and we have developed clinical pathways to do rapid linkage to care when a new patient is diagnosed, and we have incorporated the care of HIV patients in the agenda general providers. And the second one is research. We have undertaken several research projects in terms of, for example, increase the number of HIV test requests when indicator conditions of HIV has diagnosed by general providers. One of the things that I'm really proud is that we have got the complete integration between our HIV health record with the ones of the general providers. Then the health records of HIV infected people of my hospital is linked with one of the four health districts of the city of Barcelona that gathers 19 primary care centers. Then now the general providers can see the records that I am writing regarding the diagnosis or the troubles that a specific patient has, can consult the blood test, can see the procedures that I have requested, and not only they can see the medical records, but they can do as well consultations. Then they can ask us if imagine that they have to prescribe an statin, and they can ask if atorvastatin should be much more appropriate than pravastatin with this antiretroviral therapy of this patient. So it is quite important. For me, integrated care means, first of all, that to improve communications. The different health providers, I'm talking about hospitals, primary care centers, as well as community, has to regularly meet to define and to prioritize what are the items important in this disease, and to establish a table board in order to work. The second one, the second aspect, most important, would be would establish clinical pathways establish clinical pathways at the most important things at this disease in terms of HIV, for example, how to improve detection of the diagnosis of HIV, how to improve linkage to care, how to improve clinical pathways, to do rapid ones, to improve the antiretroviral therapy of our patients. And the third one would be the integration of the health or the electronic health records. And I put at the third one because during these 15 years I've been working in integration of care, and what we cannot do is to stop if we are unable at a moment to integrate IT systems. So everyone knows or everyone wants to have the systems integrated, but improved communication and improved clinical pathways are always tools that everyone has on their minds and on their hands, and they can do it quite easily. Then it should be very important to share electronic health records in order to share results of procedures, results of blood tests, but and it should be the aim of the goal to arrive, but we don't have to be stopped if we don't achieve at any particular moment. Through the communication, through the meetings, through the regular meetings, with the identification of the persons involved as a specific point of healthcare system or community, the roles of each person, and using the systems and testing, complaining, evaluating. It's quite important to evaluate the things that you are doing, but sometimes we assume that one thing is correct or not, or is, but it's not the reality. They are the main actors. So I think that health systems in general are accustomed to develop or to assume that they know the needs of people living with HIV, that they know the needs of people, of patients. But I think this is not the case. We should ask to the patients, what do you want? What are your priorities? How do you want to do, how you will prefer that your care should be delivered, your treatment, and I think that the time that the health system do things without people living with HIV, without patients, is quite old-fashioned. The future healthcare system should to incorporate, should to understand that the patients must to be included in the decisions of the clinical pathways related to HIV. And the number of comorbidities in people living with HIV is so high, and are all medical chronic conditions that the cardiologist, endocrinologist, these different specialties should to decide and should to talk. We are talking for the first thing that we were talking, should to discuss. Should to discuss before, after they have to establish clinical pathways in order to simplify as much as possible the number of times that the people living with HIV has to be or has to go to visit any doctor, and the number of tests that people living with HIV has to do should to be decreased, and the number of times that they have to go to the pharmacy to receive antiretroviral therapy. Then there's a decision regarding how to gather all these different chronic conditions should to have in place.